Hello, my name is Amber Pendarvis, and I am a senior at Florida Gulf Coast University in the Athletic Training Program, and this is my Transition to Practice presentation. In this presentation, I will outline the process that I will take on my journey from point A, being graduation, to point B, my end state goal and self-actualization, based on Maslow's hierarchy of needs. Before diving into how I'm going to get from point A to my point B, I would like to talk a little bit about Maslow's hierarchy of needs. Maslow's hierarchy of needs is used in many different professions, especially in the fields of education and healthcare. The purpose of the pyramid is to help us lay out the stages of needs, starting with the base of the pyramid, which focuses on physiological needs. The higher up the pyramid you climb, the more complex the needs become. The rest of the pyramid includes needs for safety, love and belonging, esteem, and at the very top, self-actualization. This slide shows a detailed map of the process that I am going to take in order to get from point A to point B while climbing Maslow's pyramid of needs along the way. The first step along my road to success is graduating from Florida Gulf Coast University with a Bachelor of Science degree in athletic training. Athletic trainers are highly qualified, multi-skilled healthcare professionals who collaborate with physicians to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries and medical conditions. Athletic trainers treat a range of patients and can work in a variety of settings. Following graduation, I must first become a certified athletic trainer by passing the Board of Certification exam. The BOC is the only accredited certification program for athletic trainers. The purpose of the BOC program is to establish that individuals have the knowledge and skills necessary, including the 5 major practice domains of athletic training, to perform tasks critical for safe and competent practice as an entry-level athletic trainer through the examination and continuing competence requirements. The 5 athletic training practice domains include injury and illness prevention and wellness, examination, assessment and diagnosis, immediate and emergency care, therapeutic intervention, and healthcare administration and professional responsibility. Once passing the BOC exam, I will then have to apply for licensure in the state of Florida. The Florida Board of Athletic Training was established to ensure that every athletic trainer practicing in this state meets minimum requirements for safe practice. The practice of athletic training is a privilege provided by the state. The board will license, discipline, educate, and rehabilitate licensed practitioners to assure their competence in this service. The next few slides will outline how I will target my weaknesses, lay out how I would look for professional advancement, and finally reach self-actualization. To fulfill my physiological and safety needs, I will take a graduate assistantship position as an athletic trainer. In this position, I will get a ton of hands-on experience with athletes. To target my first weakness, rehabilitation, I will study and register for the Certified Strength and Conditioning Specialist exam. CSCSs are professionals who apply scientific knowledge to train athletes for the primary goal of improving athletic performance. They conduct sport-specific testing sessions, design and implement safe and effective strength training conditioning programs, and provide guidance regarding nutrition and injury prevention. I will also attend the National Athletic Trainer Association's 70th Clinical Symposia and AT Expo to see what new and innovative products and services are being showcased for the athletic training profession. Next, I would like to take a women's soccer coach position at a local high school. As a certified athletic trainer and certified strength and conditioning specialist, I will be able to appropriately train and rehabilitate my athletes. I also plan on taking an as-needed weekend athletic training position working local athletic events. Next comes my belonging needs. While working towards my end goal, I plan to land a residency position working as an athletic trainer. To target my second weakness, manual therapy, I plan to become a Graston-trained clinician. Basic training introduces clinicians to Graston technique therapy, its clinical applications, physiological effects and benefits, and potential contraindications. The course also instructs clinicians on the proper use of the instrument. The advanced training introduces load, movement, and adds procedures for assessing musculoskeletal dysfunction while introducing the principles of regional interdependence and 3D kinetic chain myofascial applications. I would also like to continue coaching women's soccer and working as a PRN athletic trainer on the weekends. Moving up the pyramid to fulfill my self-esteem needs, I will take a professional jump to become an assistant athletic trainer in a high school setting. During this stage, I would also like to master my CPR skills by becoming a CPR instructor. This will allow me to teach young, aspiring students the importance of CPR and the skills needed to perform it correctly. At this stage, I would like to continue coaching the women's soccer team. Lastly, after many years of working up the ladder, I will take my end goal position as a head athletic trainer. In this position, I will be the one making all of the decisions and calling the shots, and hopefully I will be taking on student athletic trainers and teaching them everything I can about the profession and how I got where I am. I will have reached the top of Maslow's pyramid, self-actualization. This concludes my presentation. Thanks for listening.